Hi, I'm Hillary Acer, welcoming you to Raise the Line with Osmosis from Elsevier, an ongoing exploration about how to improve health and healthcare. On this episode, we're continuing our NextGen Journeys series featuring conversations with learners and early career practitioners in medical professions around the globe to get their fresh perspectives on education, medicine, and the future of healthcare. For that, I'm happy to welcome Dr. Brian Lay to the podcast. Brian is a resident physician in family medicine at Adventist Health in Glendale, California, and a graduate of A.T. Still University's School of Osteopathic Medicine in Mesa, Arizona, one of our key learning partners. He also earned a master's degree in medical health sciences from Touro University in California. And we got to know Brian over the few years that he was in the Osmosis Medical Education Fellowship program, and later when he worked with our team directly to improve question banks and curriculum alignment. So we're going to be talking to him a little bit about that experience and what other resources he has turned to and get his fresh take on residency in family medicine. Thanks so much for joining us today, Dr. Lay.
Thank you for having me.
So I'd love to start with what got you interested in medicine and in particular osteopathic medicine.
Yeah, definitely. That's a really good question, a really valid question as well. I first got interested in medicine as honestly just a overall interest in the sciences and just the application of science to helping other people. When I was in Boy Scouts, I had a surgeon who I served as a surrogate mentor for me. He guided me along the way of how medical school worked out and the path towards becoming a doctor. And I also saw him work as a volunteer doctor at Boy Scout camps, and that's what got me interested initially. I also did pretty well in my science courses in middle school and high school. That was another part of putting me towards the interest in medicine. And finally, I went to medical school. And what got me interested in osteopathic medicine specifically was learning about it in undergrad, and then also being able to learn more about it through interest groups and learning about osteopathic techniques and manipulations. And it wasn't until I went to a medical mission trip with a medical director that was actually a DO, and I saw him apply osteopathic techniques in the mission field, and also just learned about his background and training. And that's what ultimately made me decide to want to apply to osteopathic medical school.
What an interesting journey. I am particularly excited about this idea of having a mentor early on that kind of showed you the ropes in medicine and got you interested in that career. I think that's so important for our future clinicians and healthcare providers to get some, inspiration early on, especially as we see some of these staffing shortages and a lot of burnout, right? We need to continue to excite the next generation. So I love hearing that. And also, you mentioned science was an interest early on. Did you have a particular, like a favorite subject in science in school or anything that you remember doing when you were younger?
I was always just really interested in biology, and I think it also helped that of all the classes I took, I would consistently get the highest grade in biology. So I just think that biology is intuitive to me versus chemistry and physics. So some people see that as very intuitive. Supposedly, this is not a bash to all the physics majors, but supposedly physics is a study of the natural physical laws of the world, but it just didn't make sense to me. But I don't really have like concrete examples of where I thought, okay, this is wow, this is why I really like biology. But again, it was just accumulation of many different experiences. I think in particular, if I weren't to go into medicine, I probably would have went into microbiology. The cells are very fascinating, being able to visualize them under the microscope and just knowing that there is such a diverse and complex physiology and anatomy to cell. That just blows my mind every time I study about it.
Wow, that's really neat. And I can imagine that when you're, doing well in a subject, it can also be easier to continue down that path. And who knows whether it's because of you enjoyed it or because you're good at it or a combination of both. But glad that you landed on something where you get to actually apply biology every day. And you're currently practicing in family medicine. So what led you to choose family medicine as your specialty?
Well, it was a combination of a lot of different factors, but what drew me in particular to family medicine was that I had obviously going to the doctors growing up. you're intimately involved with your primary care doctor. So that was one of my earliest exposures to medicine. Also, going through medical school, I had really awesome family medicine preceptors, and I like the fact that family medicine is it's very flexible in terms of its training, knowledge, education, and also career outlooks. One of my mentors, I actually rotated at a Navy hospital in Beaufort, South Carolina, and he was doing clinic, he was doing inpatient wards, he was also seeing kids. So that was a great mentor. Another mentor that I was with, worked in several emergency rooms. He also did jail. He also saw inmates at the local jail, and he also used to have a primary care clinic. So it was essentially wanting to know the whole gambit of medicine that drew me to family medicine.
Yeah, it sounds like it's very well-rounded and gives you a good amount of variety and diversity in the types of cases you see, the types of patients you see, and the different roles you could have. So that's really interesting. A good thing to highlight for us too. So, Dr. Lay, tell us about your medical school experience and what some of the highlights were for you.
Yeah, definitely. So I went to AT Still School of Osteopathic Medicine in Arizona. It's the sister branch of the first osteopathic medical school in the United States, AT Still University, based out in Kirksville, Missouri. And at the time, I think my school is the only school that we employ what we call the 1+3 model. So typically in the majority of medical schools, at least in the United States, medical school is divided over a 4-year period. The first 2 years are classroom based, and then the last 2 years are clinical based. So going into the wards, the hospital, the clinics to see patients. And what drew me to AT Still in Arizona in particular was that they have a partnership with many different what's called FQHCs, or federally qualified community health centers in the United States. And once you get accepted, you put in a ranking list of which CHC you want to go to. And the advantage that was advertised is that in your second year, you move out to that FQHC area, and you start seeing patients a little bit earlier than typically when you would start in your third year. So you would start in your second year. So I felt like at least with my medical school education, I thought that it was advantageous in the fact that I got to get early clinical exposure, and I also got to rotate in many different specialties to just see to see early on what my interests were and how I could further pursue it or not pursue it. Yeah, I spent my first year in Arizona, and then my second to fourth year, I went out to South Carolina, Beaufort, South Carolina.
That's so interesting. And we have actually partnered with AT Still University for several years. We know Dr. Ted
Mhm.
Wendell and Dr. Craig Phelps very well. And
Mhm.
what you're mentioning here, this 1+3 model seems very innovative, but not anything out of the ordinary for them. They have always kind of been ahead of the curve and always innovating and kind of finding the next best resource to offer their students, the next interesting model, I think, to roll out and trial, and just always respected how ahead of the curve they are. Dr. Wendell, in particular, was quite savvy with technology and was introducing
Mhm.
us at Osmosis to new technologies that he was using. So, have a lot of respect for them and the whole team at AT Still. And I know that that was one of the reasons that you got introduced to Osmosis, I believe, is AT Still had adopted Osmosis at their universities. So, how did you first get engaged and how were you using Osmosis as a student?
So this was a long time ago. Excuse me if the details are fuzzy, but actually, I remember it was in our first year where I forgot exactly what happened. Either AT Still bought a subscription, or I think our classmates decided to band together to make a subscription. But I do remember in particular that we had a class osmosis account where we were able to use the osmosis learning tools and use it to collaborate with each other, which I at the time, I thought and I think it still remains to this day, a very innovative, very intuitive. Just in particular, like it's hard to collaborate, and especially trying to do it among 108 different people, it's very difficult. So I remember using Osmosis where we would upload our lectures, and then we were able to annotate it together. We were able to generate flashcards together. And that's how I was first exposed to Osmosis.
That's really neat. And you're speaking about one of our kind of legacy features, the workspaces tool that I believe today you can only have access to if your university purchases that subscription. But I'll confirm, we can maybe add that to the show notes. But it is one of my favorite features because I loved the idea of being able to upload some of your course documents and get
Mhm.
support with figuring out what to study. And then it could actually kind of algorithmically, excuse me, map them and recommend flashcards, questions, videos, etc. And you could also collaborate with your classmates. So that's one of my favorite features. I'm glad you pointed it out and glad it was helpful for you in your studies. You eventually came on to become an Osmosis Medical Education Fellow. How did
Mhm.
you make that leap? And do you have any memories or highlights from your time in that program?
Yeah, so if I recall, I was introduced to the education fellow through it was an email through Osmosis, and then it's not really glamorous. I got an email and I thought, oh, this is interesting. I applied, and then I was offered the educational fellow position, and that's how I made the leap from a user of Osmosis to a fellow with Osmosis.
Well, a number of students are getting those exact emails as we speak because we are in our recruitment cycle and we're looking for top users of Osmosis to join that program. And so that was actually one of the criteria is you had to be an avid user of Osmosis to
Oh, that's
join.
right.
So
Yeah.
yeah, so that's awesome that you joined through the program. And I think you had engaged a number of different activities. We had various events and referrals. We had product feedback surveys, and you continue to give us feedback to this day, which I'm grateful for. But we also that opportunity actually also led to you joining the team as a consultant. So tell us a little about the type of work that you did within our team and what types of projects you worked on.
Yeah, definitely. So the major thing that I was involved with as an osmosis consultant was I'll try to explain it because it's actually a little bit complicated, but it's not that complicated. But I'll try to explain it to the best of my ability. But I was considered a curriculum alignment consultant. So with the different schools that Osmosis was partnered with, they would send their syllabus of their programs. So most of the time, I worked on the PA programs from different schools, and at the time, Osmosis was creating a very extensive and very exhaustive video library, and my position was meant to provide videos that the students in the school could watch to in order to supplement their reading. So, for example, let's say the PA program at AT Still, they sent their syllabi and curriculum and said, "This is our syllabus. These are our learning objectives. What videos do you think would best to supplement the learning of our students?" And that's essentially what I did. I would read through the syllabus, and then I would compare it to the very extensive, very exhaustive Osmosis Live video library, and then make recommendations. Um,
So you helped not just your fellow med students at other medical schools, but also PA students and probably who knows, other nurse practitioner students at different schools, basically any partners of Osmosis, you were helping to make sure that their curriculum mapped to our content.
Correct. Yeah. Yes. And yeah, it was meant to as a supplement because I know that going through education and whatnot, there's many different methods of learning, and I know that for a lot of people, like reading from the book is just not helpful, and then from YouTube, there's like God knows what is on YouTube, right? There's not to say that YouTube doesn't have good educational information, but you have to be careful because sometimes the information could be wrong. Whereas with Osmosis, the videos are specifically curated for medical learners.
Yeah, we had a whole medical team building them out. So they were checked and checked again and checked a third time and continue to be updated as the standards change. I do believe that YouTube just recently launched a new tag that actually filters for content created by kind of certified medical professionals, which is great. So
Oh,
they
okay.
are also helping to ensure that the content is credible there. But as you've continued your journey, Dr. Lay, you are in your third year of residency at
Yes.
Adventist Health.
Mhm.
How has that experience been? What are some of the learnings that you've had so far?
Yeah, I think the most major thing, especially, I'm going to be graduating in about 23 days, and I'm going to be a attending physician soon. I think the biggest thing that I've learned so far is you really don't know what you don't know, and again, that just goes back to one of the reasons why I wanted to pursue medicine was that there's always a endless pursuit of knowledge and improving yourself and staying up to date with knowledge. But also overall, I think the experience has been it's definitely been difficult and challenging in its own ways, but I do think that it's also a privilege. It's also a privilege to be a physician and know that with your knowledge, education, skill set, you can be there to help patients. And not only that, you could apply your education in many other areas beyond the clinical side.
Wow, what an interesting takeaway. Yeah. And I'm sure things are constantly changing in medicine. In fact, I remember Shiv and Ryan, the co founders of Osmosis, used to say that medicine was just so hard to stay accurate and up to date with because it was so much volume. There's tons of
Mhm.
information.
Oh yeah.
It's very high stakes. You're not dealing with the computer software, you're dealing with people's lives.
Hmm.
And it was ever changing, right? We're constantly learning more about different technologies and different medicines and drug therapies. And so you really do have to stay on top of your game. So really interesting. And hopefully, Osmosis and Elsevier can stay ahead of those curves with various tools and content, and I'm sure you'll continue to help us with that.
Oh yeah, yeah, definitely.
Amazing. Well, on that topic, we are constantly trying to fill in knowledge gaps, and you have been a part of the team helping us to align our curriculum. You have a really good knowledge of our existing video base, but is there a topic that you would like us to fill in a gap about that's of particular interest to you?
Honestly, that's a really hard question to answer. If you were to ask me maybe 1 year ago, I definitely would have had ideas, but I recently looked at the video library and there's a lot of topics that I was very surprised that Osmosis covered. I believe there's a video on like how to perform like well child checks. That's basically how you see like pediatric patients for their annual exams, and that's something that I just learned through seeing a lot of patients and doing a lot of reading. But so I was very surprised that such an obscure topic like osmosis had. But I think one topic that I don't really see really discussed that often is like principles of critical care medicine. And again, it's such a niche topic, but yeah, it's hard to find like content for lack of a better word on critical care medicine. I'm sure it's out there, but I've yet to find it.
That's a great topic for us to add to the list. I will definitely pass it on to our team. Just back to your note about that kind of obscure video on child well exams, we have been building out a lot of content on clinical sciences. So for those later years, I believe that is one of the main topics that's covered in our pediatrics section now.
Mhm.
So lots of new videos to explore, lots of new questions and flashcards to explore too, and also some cool integrations with other Elsevier products like Complete Anatomy and Clinical Key Student and soon Clinical Key AI. So definitely keep an eye out for other resources that may still be relevant to you. We have a lot of students like formerly yourself and early career health professionals in our audience. I'd love to get your advice to them about meeting the challenges of this moment and just approaching their career in healthcare.
I definitely the advice is very cliche, but I would say the major thing is to really again really just remain humble just because things are always changing. There's always new information out there, and those who don't remain humble, in my opinion, can't really thrive in this environment just because there's always something new to learn. Definitely trying to find an outlet beyond learning. There have been studies that have shown that your brain needs a break. Literally, your brain needs a break in order to process information. And at a certain point, if you're just grinding all the time, 12 hours straight, like you're not learning anything. So definitely try to find a healthy outlet. Finding a support group is very important too. But I think I think one of the biggest things is to definitely try to find a very reputable mentor. You want to find someone who is knowledgeable enough about what you've been through, what you're going through, in order to provide good, solid advice, just so you have them to go to when you need help.
That's great advice. And if I can recap that a little bit, it sounds like staying humble is key. Things are always changing, things are always advancing in different ways that you need to stay on top of. Finding that support group is really important. Taking
Mhm.
brain breaks, giving yourself a little bit of self care, and
Mhm.
finally finding a mentor, which actually brings us full circle to what you started with is having that mentor early on in your life who kind of showed you the ropes in medicine and finding someone in particular who's really reputable and kind of takes you under their wings. So I think
Mhm.
that's a great point to end on. Thank you so much, Dr. Lee, for being with us today. Is there anything else you'd like to leave our audience with?
Again, I really think that the most major thing is wherever your stage of your learning or training is right now, don't give up, because at the end of the day, you know what you want, and you know what your passions, desires, and interests are. And if this is something that you really want to pursue, then yeah, definitely go for it. Don't give up. Try not to let others like dissuade you if you truly know that this is something that you really want to do.
What a great note to end on. Thank you so much for being with us today, Dr. Lay. We really appreciate your time. And with that, I'm Hillary Acer. Thanks for checking out today's show. Remember to do your part to raise the line and strengthen the healthcare system. We're all in this together.
If you like this podcast, please share it on your social channels. You can also subscribe to the series and check out all of our episodes at osmosis.org/raisetheline podcast.